We've got much more to come on this Sunday morning here on 3 TV.
Up next, a teenage actress is putting a spotlight on breast reductions. We'll learn how they can help women suffering from back pain and other related issues. It is 7:39. Modern Family actress Ariel Winter just made a big change, and it is making headlines. The 5'1" tall 17-year-old actress says she recently got a breast reduction, going from a 32F cup to a 34D. Winter says she made this decision after suffering emotional and physical pain from having a larger chest at just such a young age. And we have Dr. Daniel Shapiro with us from Shapiro Plastic Surgery, here to explain to us the pros and the cons of breast reductions. And Doc, I want to start with the physical and emotional pain she refers to.
Yeah, you know, her problem, she says, started really overnight when she was about 15 or so. And over the course of 2 years, her breast went from, you know, basically being flat to an F cup, which is a big deal when somebody is 5'1".
Yeah.
And she said that the real kind of breaking point for her was when she went out to try on some bathing suits and couldn't find anything that fit her well, and she said enough is enough. She said that she'd had a lot of back and neck pain, which is very common in people that have large breasts at a young age. We call it juvenile hypertrophy. That's what a young girl with large breasts is called in our world. So, you know, neck and back pain and shoulder pain, and really it's a big deal for these girls because they feel as though they don't fit in. They feel like they're getting too much attention, and she felt a lot of that kind of things. Ariel did.
And clothing is
and
awkward
clothing's a big deal. So
yeah.
the other thing is that studies have shown that in people that have the breast hypertrophy at a young age, there's 3 times the number of eating disorders.
Really?
So yeah, so there's a compensation for that attention that they're getting, and they don't have a really good body image.
So how early do we start considering this maybe for our children, or at what age can we start talking about a breast reduction?
A lot goes into that equation. We as plastic surgeons look for someone who is mature both physically and basically we think about 2 years after people start their periods is generally when people start to slow down on their growth. There are ways to check growth, whether it's complete or not, but it's pretty complicated. So usually around 15 or 16 is when people start thinking about the breast reduction.
And you think of the breast augmentation, seems to be a very simple and common surgery these days, but the reduction is a different deal. Tell me what that surgery is like now.
It's a little bit more complicated in the sense that, you know, it's more surgery. It usually takes about 2.5 to 3 hours in the operating room. And there are, depending upon what we face in terms of how large the breasts are, in terms of what we want to end up with, as plastic surgeons, we want to end up with something that looks very proportioned for someone's body. So Ariel is 5'1", and she went from a F to a D cup, which is a big deal. That's 3 cup sizes. So depending upon how large somebody's breast will kind of dictate what kind of surgery we perform. So it usually involves moving the nipple higher and reducing some of the volume. So there are some suture lines and scars that we have to deal with.
So what is that recovery like?
You know, it's surprisingly quick. I think people are back doing what they want to do within a week or so, and I think the scars heal very, very well within about 2 or 3 months.
Wow. And then can that come back? Can that tissue come back then?
It can, and it's very rare. I've been a plastic surgeon almost 23 years, and I've only seen it maybe once or twice in my practice. But it can happen, and it's a little unpredictable. Sometimes that will happen after children, or their breasts will get larger, more large than one would expect with pregnancy. But there are a few patients I've seen that they get larger within about 2 or 3 years of having the breast reduction, and usually they'll wait it out, or sometimes we'll redo the operation.
And if someone is considering having a baby, should they wait until after the baby? Because does the body change that much?
No, not necessarily. I think that people, if they're having problems, they should go with their parent and get a consultation. And you know, a lot of goes into our equation of who's a good candidate. We like to look for somebody who's mature emotionally, and we look for some of those symptoms of having the back and shoulder pain or the neck pain, and really how it's affecting their life.
What do you really want to drive home with parents or girls as they mull over a decision like this?
You know, I think basically not to shun away from it. I think it really affects a lot of young girls. I think now with social media and the internet, I think there's a lot of cyberbullying that goes on, and I think it's a real handicap emotionally. And I think that parents should look at their child and see how they're feeling, whether or not they feel as though it's an abrupt decision, if it's been bothering them for a while, and just to come in for a consultation.
Is there anything that we could do besides surgery?
They're not too much. You know, it's a disproportionate enlargement of the breast. So that's what people that have this situation face. It's not something that really losing weight is going to affect.
Yeah.
Unfortunately, a lot of the girls will feel as though people think that they look heavy and will try to lose weight, and that's not it at all. Yeah. There's disproportionate enlargement. So the best thing is to get a consultation.
Yeah, important to talk about with the fam, with mom and dad, and then talk to a doctor. Thank you so much.
My pleasure.
Great advice.
You got it.
Let's toss it over to Kim for a look at the forecast.